Hey, it's Dr. Birchler, Life After Lyme Disease. Got a few questions recently on problems basically with chronic joint pain, aches and pains in the joints after Lyme disease. And this kind of thing certainly can be really prevalent, the swollen joints and things in the acute phase of Lyme. But folks who've had that, maybe been treated, maybe not, regardless, oftentimes have chronic joint pain, oftentimes the rest of their life. And a lot of you out there watching this, a lot of the public would not immediately think of food when they think of joint pain. They would think of arthritis as if it's this thing that just you get, but there's not really a cause of it, or it's genetic, or it's just getting old, or something like that, or injuries to the joints. But they wouldn't necessarily think of food in terms of joint pain and arthritis. But certainly, when you're dealing with joint pain, specifically with Lyme, where there's a tissue damage, inflammation, foods are going to trigger joint pain like crazy. The number one food I would tell you if you're having issue with joint pain to understand or eliminate is wheat, and that's like in every diet of every meal of everybody's diet in our society. But I'm going to relate a story to you as well, just personally, that was even a bit eye-opening to me. When I was in the kind of the acute phase of Lyme disease 3 years back, I knew that I had it. A lot of people don't, but I knew that's what was going on. And I happened to be on a trip to another state for business at that point in time. And as I often do when I'm out of town, I find the local Whole Foods and go get some of my food there. And when I was there, I went and I was looking for something called manna bread. Probably most people have never heard of that or used that, but it's like a low temperature sprouted bread, like organic wheat bread. So it's like 120-degree, low temperature sprouted. So not really a cooked thing, but kind of they bring the seed to life. And I happened to go buy some of that at this Whole Foods and just have with me for the afternoon and evening. And while I was out of town, and some for the hotel for the evening. And even that organic, low temperature sprouted, like is healthy hippie as you can get. Man, it gave me palpitations with it. Now I don't routinely eat much wheat, but I had a cup of wheat, including this a couple of times where I had this manna bread during that acute phase, and literally within minutes, my heart would start to palpitate, feel very bad at that time. I would also notice, not so much immediately, but oftentimes the next day, if I had a little bit of something like that, I would have joint pains. I feel like my joints were swollen. I'd never had that in my life before this Lyme stuff, but I'd wake up and feel like my fingers are swollen or something like that. And at the beginning, I was like, is it random? But I really traced it. If I had even touched any wheat, even a small amount, it would usually be that next day that I would have the swollen joints. Now, fast forward years and talking with dozens and dozens of patients in my own practice dealing with Lyme, and then reading all kinds of stuff, talking with other doctors who focus largely even on Lyme disease in their practices. And wheat is just a very, very common trigger for joint pain, for swelling, that kind of thing. Organic or not, doesn't seem to matter. I know stuff in our country seems to be worse than overseas. If you're watching this elsewhere, my opinion is, if you're in the U.S., having wheat stuff, organic or not, is probably going to give you some trouble with the joints. If you have Lyme, I would recommend to stay away from that. Move to the fruits, vegetables, nuts, and seeds. Move to the grass-fed meats. Then there's even some things in those categories that we can be really sensitive to when you're dealing with something like this. But anyway, understand wheat's going to make your joints hurt. For a lot of you out there, if you're having that, if you're not aware that your food's going to trigger these problems, just try it, self-experiment. Once you experiment and cause it, or you remove it, remove the trigger, and you get better, that's more valuable than any test, any blood work, any yakety schmackety anybody can give you, because you experienced it, you caused it to happen, you have control of it, and you felt it, and that will be more valuable to you than almost any type of test could. We'll get into discussing some test options that give you a little bit more broad info on food sensitivities and that things at a future time. So thanks for watching. Hope this helps.